Carpal tunnel is a very common symptom that plagues many people. We'll talk today about common causes for carpal tunnel, how to know if you have carpal tunnel syndrome, different treatment options available. If you've ever woke up in the middle of the night and found that your fingers are asleep, particularly these three fingers, and perhaps the side of this finger, you might find yourself shaking your hand, dangling it off the side of the bed to get your sensation back. That's a common symptom with carpal tunnel. Other common symptoms include weakness, loss of grip, numbness, tingling, or pain that can radiate from the hand up the arm. Carpal tunnel syndrome is often caused by repetitive activities. Many things we do in society today or in our jobs can contribute to carpal tunnel syndrome. Simple things such as typing, playing the piano, any repetitive activity can be linked to causing carpal tunnel syndrome. This problem is commonly experienced in the hand and the fingers. With this syndrome, the median nerve comes through the hand and comes up into a distribution into these three fingers and this half of the ring finger. Common symptoms include weakness, loss of grip strength, numbness, and if it persists for an extended period of time, some of these symptoms can become more permanent. So how do you know if you have carpal tunnel syndrome? Sometimes patients might come in and tell me they have numbness in their hand and they're not sure if it is carpal tunnel syndrome. The common distribution would involve the radial three digits, the thumb, index, and middle finger, and the medial aspect of the ring finger. This can be any combination or all or simply one or two of the digits, depending on where particularly the nerve is being compressed in the carpal tunnel. Carpal tunnel syndrome gets its name from the median nerve coming through the carpal canal, extending up into these fingers. There's a narrow entrance as the nerve comes in, and various structures also occupy this space. Tendons that flex the fingers cross through the same tunnel. So with repetitive flexing or gripping or use of the hand, tendons are sliding back and forth through the carpal canal. The median nerve doesn't have a lot of extra space, so any extra swelling can spread and compress the nerve against the transcarpal ligament. There's a ligament crossing the hand here that the nerve can smash against, causing these symptoms. Symptoms can be very brief, they can be intermittent, or they can last for an extended period of time. Symptoms might, for one person, only be for a brief period of time at night, for a few minutes or an hour or two. They might persist and become long or extended through several hours of the day or 24 hours a day, depending on the extent of the condition. The way to diagnose definitively to confirm the presence of carpal tunnel syndrome would be to obtain nerve conduction studies. This can be performed where a physiatrist or other similarly trained professional can send some electro impulses across the nerves and measure the strength, the speed, the velocity of the nerve conduction from point A to point B. A lot of information can be gathered from this to determine, is it carpal tunnel syndrome, and how severe it is and the extent of the damage. It can be diagnosed based on symptoms alone, and not all scenarios would require a nerve conduction test to definitively confirm carpal tunnel syndrome. Other tests can be performed. If you see your healthcare professional, one test that might be performed is the practitioner may push directly over the carpal canal with their hand, and that would smash the median nerve briefly, and if that exacerbates the symptoms causing numbness in the fingers, that's one positive test. Another would be called the phalanx, where the practitioner would bend the wrist into a flex position. The median nerve transfers across the hand. By pressing the nerve, that can also cause numbness and tingling. At home, sometimes patients might notice that if they sleep at night, perhaps their hand is under a pillow. If their hand is in a flex position, they may notice the fingers go to sleep. They may then notice if they put the hand in a more rested neutral position, after a period of time those symptoms decrease because the nerve is in a more relaxed position. Treatment options for carpal tunnel syndrome have a wide variety of options. Several things that you can do at home. Anti-inflammatories can be used to calm the inflammation down. Ice may be applied over the hand or wrist in general, but particularly over the carpal tunnel to give it ice to decrease swelling. However, you'd of course want to be careful not to over freeze it and cause frostbite or other problems. But ice can decrease the amount of swelling and helps also alleviate symptoms. Another important thing that can help is keeping the wrist in a neutral position. Various braces have been developed that will keep the wrist in a neutral position. Most will have a rigid centerpiece, perhaps held on with laces or Velcro straps, particularly at night to sleep in a neutral position so that your hand isn't placed in a position that would further compress the nerve. More advanced treatment options that might be offered by your provider could include a cortisone injection, which can be performed directly into the carpal canal. This would be a steroid to suppress the inflammatory response in this location. Other surgeries also could include, but not be limited to, carpal tunnel release. One technique for doing so would be an endoscopic carpal tunnel release. There would be an incision above and below the wrist where tools and the camera can go up inside and cut and open that transcarpal ligament, creating a larger canal, taking the pressure off of the nerve. Other techniques could include an open incision, where the incision is made to the hand to go in and also open the carpal canal. So treatment options for carpal tunnel syndrome are based on getting the pressure or the inflammation off of the median nerve. So whether you do that with an anti-inflammatory, with ice, with a surgical intervention or injections, the individual technique is designed to take the pressure off of the nerve. So you may ask, what happens if I have carpal tunnel syndrome and it is left untreated? Pressure put on a nerve over an extended period of time can lead to permanent damage. Fortunately, the median nerve at the wrist is often more forgiving than nerves can be in other locations in the body, and often patients can notice immediate or quick or even full relief after a successful treatment to decompress the nerve. However, that is not true for all people. Some people may have it for a short period of time and it can lead to more permanent damage. So it is important, if you feel you have carpal tunnel syndrome and if you have treated it on your own unsuccessfully at home, do not delay. This should be looked at by a healthcare professional and further evaluated to be sure that you are getting the proper treatment. Because you can always take the pressure off of an injured nerve, but if there's permanent damage that occurs, this may become permanent and untreatable. So if you see your healthcare practitioner, several questions you may want to ask them. Is it carpal tunnel syndrome? And if so, how extensive is it? Is it a mild, moderate, or more severe form? And you would for sure want to discuss with that individual any treatment you have sought or performed and what your results with it have been. Carpal tunnel syndrome left untreated can also lead to other symptoms of overuse in other areas. For example, if you have it on one hand and ignore it, you may be using your other hand or other body parts in an abnormal manner, which may cause other issues to develop there. Carpal tunnel syndrome can be caused by increased work activities, overuse. It's not uncommon in pregnancy, or if there's other conditions that cause an increased amount of fluid retention. With increased fluid in the body, that can also increase the pressure in this location. So there's a variety of causes. Most important is to identify that it is carpal tunnel syndrome, and then to identify causative factors and eliminate any of those causative factors that can be eliminated, and to treat the symptoms and observe for symptom relief. But importantly, if you're not getting symptom relief and if symptoms are progressive, you definitely would want to seek medical attention and evaluation so that your condition does not become permanent. There are other things that can mimic carpal tunnel syndrome that should not be ignored. Particularly of concern could be if you have a pinched nerve, for example, in your neck or possibly shoulder, that could cause symptoms down below in the hand or wrist. So you would not want to just assume that it's carpal tunnel syndrome and possibly ignore a more serious condition. This is a model of the hand with various structures, muscles, etc. removed for an example's sake. This represents the transcarpal ligament. Underneath this is the carpal canal. The tendons that flex the fingers, there's various structures that come underneath this transcarpal ligament. Illustrated in yellow is the median nerve. This nerve is the guy that gets pinched. Of course, he extends up into these fingers. These white structures represent the tendons that come through here. So the carpal canal is the nerve getting pinched in this location. So the treatment options are all geared towards getting inflammation off of the median nerve. To do so, this can be done with treatment options of anti-inflammatories, rest, activity modifications, limiting the extent of flexion, extension, bending, moving the wrist and fingers, resting the area, or treating the symptoms that are there to suppress the inflammatory response. If these are unsuccessful, more aggressive techniques such as injections or surgical intervention can be performed, which are geared towards taking the pressure directly off of that nerve. And doing so is important before the symptoms become more prolonged and more extensive. So if you feel you have carpal tunnel syndrome or you're having some of these symptoms, it is important that you are seen and evaluated by a qualified practitioner who can evaluate, diagnose, and help treat your symptoms. Carpal tunnel syndrome does not have to be a life-altering event. It does not have to limit your activities or cause you to give up those things that you enjoy in life. However, if it is left untreated, it certainly may be affecting your life to where you're not enjoying the things that you would like to do, or in the sake of work, the things that you have to do. So if you feel that you may have this problem, please seek out further help from your local healthcare practitioner. Thanks for joining us today. Hope you have a great day.